Dr. Doug here with the KOV FM, the heart and soul of San Antonio. Thanks for listening to our first Saturday conversation with S.A. Reeds, Pamela Tobin, and Emily Dowdy. That was a great session. But now, we have a bonus section for you today. Today is normally it is the second Saturday, but something happens. I think it's called senioritis or something. I had overbooked someone last week, and so I apologize. But we have with us today the Honorable Ron Nirenberg, and Ron speaks to the community. How are you doing today, my friend?
Doing all right. How are you, Doug?
I am doing outstanding for a day that it's 104 outside. I'm in some air conditioning here, and sounds like you are too.
Yeah, I am now. But yeah, we were out at the Alamo Dome with the PPE giveaway for small businesses, and it was hot already at 9 o'clock in the morning. So hope everybody's staying cool and staying hydrated.
Awesome. So, as time moves on, things change and some things don't change. How are our numbers here with the pandemic here in the city?
We're starting to trend down in a consistent way now. So we finally broke through and are about half of what we had in the hospitals at the high point in July. But our positivity rate remains still very high. So we've got to continue to be vigilant, because we've got to see that positivity rate come down below 5% before we feel good and the public health officials feel good about going back to school and class in person. And we're also concerned about Labor Day, because, as you know, the spike that happened in July really pointed back to people letting their guard down and things opening up around Memorial Day. So we've got to continue to stay vigilant. If we do that, physical distancing and wearing a mask and staying away from large crowds, we think we can start getting back to normal. Of course, we're all waiting for a vaccine and therapeutics. We just got to modify our behaviors, and we can stay healthy and save lives.
Well, one of the things I think today is that with the testing, that one out of every five in San Antonio are testing positive. Is that a correct statement?
So it was about 2 weeks ago, but we've seen the positivity rate in our tests come back down where we started from, although it's not as low as it needs to be. So at our low point in May, we were about 3.5% positive, meaning 3.5%
right.
of test results were coming back positive. When we peaked in June and July, and here in the early part of August, we were seeing positivity rates in 25% range. So extraordinarily high. That means that the transmission was very rampant, that the infection was out and promulgating very quickly, and it was doing so throughout the community. So over the last few weeks, as people have really been buckling down and practicing what the public health professionals have been telling us, that positivity rate now has started to decline, and we're now at about 12%. We'll be updating that, which we do every week, on Monday, and so hopefully we'll see another marked decline, and again, steady progress, hopefully, until we start to open up schools at below 5%.
Awesome. So now this, the other thing I wanted to ask you about was the death rate. Texas just went over 10,000. Is that correct for the state?
Yeah, and it's unfortunate because, early on in this pandemic, when the local communities were really in charge of the response, and, most of the urban communities were in stay-at-home orders, and there was some great cooperation from the communities before the Texas government started opening things up. We were one of the lowest in the entire country, particularly here in
San Antonio. Yeah, absolutely.
As June and July opened up, it skyrocketed, and now we're about 1/10. Texas is about 1/10 of all of the infections in the country. 1/10 of them here in the state of Texas, and so July was a deadly month, and we don't want that to happen again. So again, we're out in the community everywhere we can, talking about how to get tested. How to take precautions, and certainly what to do in the event you are sick.
So when it comes to testing, there's a big thing going on now, nationally at least, talking about the testing has really slowed. Has that slowed here in San Antonio?
It has. Demand has come down, which we want to make sure that people who are suspect that they may have been exposed to somebody who was infected get tested. We want to make sure that anybody who has symptoms gets tested. But the demand for tests has actually come down fairly significantly. And as long as the positivity rate starts coming down as well, we're not overly concerned by that. But our testing at its peak, we were testing with the private labs and the public free labs, probably about 7,000, 7,500, upwards of 8,000 people per day. That number now has dropped roughly in half to around 4,000 a day at most. But at any given day, we volley between 2,500 and 4,500 people being tested, and that includes the private labs, Freeman and the pop-up labs, as well as those private providers.
The ones that are the pay labs. The private providers, those are the pay labs, correct?
Yeah, that's right. So our free labs, again, are tests administered by our public health department. They're free. They don't require a doctor's appointment. They don't require health insurance. We just ask that, if you're only getting out of convenience and you really don't have a reason to get tested, save the free test for those who really need it.
Awesome. So now, as I go around, I see more and more people, wearing masks, and so I've been encouraged, and a lot of our retailers, it seems like they are in line with what the recommendations are as far as wearing masks and those types of things, and supporting social distancing. So that's been a plus for us, I think.
Yeah, it has, and the small business community here in San Antonio has really stepped up. They're doing absolutely everything they possibly can do to keep the lights on, to keep business going, and keep people employed. So we want to help them the best we can, and that was one of the reasons why we had the PPE giveaway this morning. We've had many of those kinds of events throughout the community to give small businesses the equipment they need to operate safely. And it's also the reason why we're appealing to the general public. If you need to do some shopping, if you need to get some food or go out to eat, shop local. And also when you're visiting a local business, be mindful. They're doing the best they can to stay open. So it's also on us as patrons of small businesses to cooperate. Wear your mask when you're inside their establishment. Pay attention to personal hygiene. And for goodness sakes, just be nice to the people that are running these businesses, because they're under an extreme amount of stress, just like everybody else.
They are under a lot of stress. Thank you for supporting them and for bringing it up. That is awesome. So we were talking about school here for just a minute. So, I saw this week that there are somewhere in the area of over 300,000 youth or school-age children who have contracted the disease. Did you hear about that number?
I hadn't heard that number, but we have heard. So let me pull that back a little bit. The number of pediatric infections has been steadily on the rise here in San Antonio, and that's for people that are under 18. When it was probably about 3 or 4% early on in this pandemic, it's now a full 12% of our cases are people under 18. Not as many go to the hospital, although they do. But it just shows you that anyone is getting this disease that is exposed. You're not immune to it, and so the risk with opening up schools too soon is that with the rampant infection out in the community and the likelihood that a young person could be carrying it without symptoms, it raises the likelihood that we can get another outbreak. So our public health department has been working with local school officials, with parents and teachers, and with students themselves to make sure that everybody knows the indicators that we're watching that will tell us it's okay to start in-person schools. Our public health department has said that we should not go back to school in person any earlier than September 8th. And before we know it's ready, we're going to be looking at certain indicators like the positivity rate of infections in the community, how long it takes to double the number of infections in the community, and then, of course, a steady decline of cases that are happening in the community.
So let me ask you. So, I know the standard that we've set here in San Antonio, but it seems to me like some of the smaller schools and private schools and charter schools that they're opening anyway. And why is that?
Well, because the state attorney general issued an opinion that basically casted the doubt and with the governor's consent, nullified the ability for public health departments to mandate closures of schools before there was an outbreak. Basically, the state of Texas's approach is that we're not going to prevent disease. We're just going to allow you to quarantine it when it arises. And so, it's unfortunate because it's created a lot of confusion, and it seems that the attorney general, whenever he seems to make a statement during this pandemic, only creates confusion and chaos, and ultimately that costs lives and a lot of heartache. So what we're doing is working with the public school districts and with schools in general, no matter what their classification, and asking them to please be mindful of the public health guidance, watch those indicators, and whether or not you're mandated to do so, go ahead and comply with the medical guidance, because just like you all at the schools, we are working hard to maintain the health and safety of our community, and we are all in this together.
I agree with that. It just seems really strange because I saw the other day their football practice is open for some schools.
Yeah, and again, unfortunate because of the interpretation that the state attorney general has given us. And some of the schools are using that as cover for doing some of these activities that we know the public health professionals are advising us not to do. And so, again, not a good idea with the level of infection that's out in the community to have full contact, close contact sport recreational activities. They have already said that very clearly, and certainly not a time to go back to in-person schooling. We're going to continue to put out that guidance. We're going to continue to have our medical director put out the directives, and we're going to continue to plead with people, regardless of what they might be hearing of some inane statement by our state's attorney general. Do the right thing.
Yeah, because it just some of the pictures I saw were kind of sent chills. I'm glad they don't have kids in school anymore because they played sports, and I got to tell you, if I did have a kid in school, I wouldn't have them out playing sport. And it just seems that they were. Well, at one scene, it was after practice. I mean, the whole team just got into a great big mobs, kind of a circle kind of thing, and cheered the school's whatever song or whatever. But there weren't 6 feet between all 50 of them. They were just all together on a whatever the school logo was in the middle of the field, and that just seemed to me that's just not right to have that happen.
It's playing with fire, and we know there are a couple of suburban school districts that open that are not actually inside Bexar County, although they have a couple schools inside Bexar County that have already opened, and both Comal ISD and Bernie ISD have already confirmed cases of COVID.
Right, I saw that.
This is playing with fire, and we need to make sure that we keep our community safe. And it's not because we don't believe that we're going to have zero infections in the community before we start opening things up. It's just that we want to make sure that we have the best chance for success, and we limit the likelihood that there's going to be a massive peak like we saw in June and July. We've got to work together to make sure that it doesn't get out of control. And if it gets out of control, we're going to have to start shutting things down again, and that would be truly devastating to our livelihoods as well as cost people's lives.
Wow. Well, keep up the great work. We appreciate your leadership and everything. I know we're almost done, but I wanted to ask one more topic here, if you don't mind. A couple more minutes? Okay, great. Thank you. I appreciate that. I just, you and I had talked about it before about the racism proclamation that it is a public health issue, and so we've seen some states and some municipalities that are more progressive thinkers. They've actually gone and done that, and I know the city council was considering doing something similar. Can you tell us a little bit about that?
Sure, yeah, that has gone through the Public Health Committee already to go through the language and basically tie it to actions that we can begin to take as a city council to address these issues. And so the resolution itself that would declare racism as a public health crisis answer is this city and this country have been built on policies, racist policies in many cases, that have led to inequities and socioeconomic disparities that we are seeing even to today. And that is true here in San Antonio, where old redlining policies kept people of color out of certain areas of town, and those areas of town had lesser and lesser investments in. So if you remember back in 2017, when I became mayor, I worked with the city council to start budgeting on equity, basically recognizing those disparities and starting to do something about it, putting more investments into areas of town that had seen disinvestment for so many years, and particularly infrastructure investment, streets and sidewalks, for goodness sakes, on the east side, and bus service on the west side and the south side, things like that to help redress some of these historical disparities. And so that's what this resolution is about, is to recognize it and declare it, racism as a foundation for inequity in America, certainly here in San Antonio, and start building policy on it. I'm excited by that because it is just one more thing during these last few years where we have called something out into the open that we've taken for granted for far too long. And my hope is that it will not stop as just a statement, and that we will begin to build action on it, which we have done through the budgeting and through other areas of policy making over the last couple of years.
Yeah, you've done a great job. I definitely give you credit for that. Since you've been mayor, there have been changes in the way that things are, and you can actually see it in sidewalks and things, because just like everything else, like budgeting, like politics, racism is local. So how can some of our listeners who don't keep up with all the most current events, how will they be able to see some of the changes?
Well, again, what I would encourage people to do is to visit their city council offices, speak with us online, especially during this pandemic, and also get active in their neighborhoods. The other thing I would say is that we just on Thursday took a vote to put a measure on the ballot that would take a portion of the sales tax that's already being levied on San Antonians, and instead of purchasing land way out in the rural areas, we're going to now start putting that money into workforce training and certificates and degrees for our local community. Workers who are underemployed or have been displaced by the pandemic will now have the opportunity to go finish their degrees or get a certificate for a higher paying job for free. And it would also include some additional services and support to help make sure that you have the supports necessary to make it through the training certificate or the degree program. That's going to be on your ballot in November, but that was one effort we took to make sure that we start breaking these cycles of poverty and begin to create access to economic opportunity and socioeconomic mobility in our communities where we had not been investing before. It's high time we start investing in people, and that's what I want this to be about.
That's awesome. Just speaking of that, a real quick story. When I worked my way through college as an electrician, and I did that because they had in down the street from where I lived in Chicago, they had a electrical training center, and you went there at night to take classes, and you passed the certification, and you got your not your journeyman's, but you got your apprentice license. And I got my apprentice license that way, and so I was longing to see something like that happen. So hopefully you can make that come back to San Antonio, because I think that's sorely needed. Because of there, every college isn't for everyone, but for sure, being able to earn a living wage is for everyone.
And without that certificate, even if it's not a college degree, without that certificate, you can't get that job. And so we want to make sure that people have the opportunity. They can choose college or they can choose a certificate, but let's make sure that they have access to a well-paying job to be able to support themselves and their families. We do not have to be a poor city if we start investing in people. And this program, if people vote for it in November, will give that opportunity over 4 years to 40,000 people in our community. And coupled with the Recovery Act that we put together with the City Council in May, we're now reaching upwards of 55 to 60,000 people over the next 4 years.
Awesome, awesome, awesome. Ladies and gentlemen, you heard it here. Mayor Ron Nirenberg speaks to the community. Thank you so much for your time today. Thanks so much for letting me run over, but I think it was important to get the message out about things that are going on here locally.
Always great to talk with you, Doug, and have a great day. Stay cool.
Thank you. You do the same, my friend, and you stay safe. KRV FM, the Heart and Soul of San Antonio. This is Dr. Doug here, our Saturday conversation. That was just a second Saturday conversation. You got a bonus Saturday conversation today, and that was our Mayor Ron Nirenberg talking about everything from the pandemic to racism, institutional racism, to school, and to education and job training. So, thanks so much for listening today. We'll be right back in just a few minutes. We'll be right back in just a few minutes. I should have had my song queued up there, but now we're ready. Dr. Doug here with you, and right now we're going to do a little bit of, we'll see.